Welcome to the podcast. Today we're diving into the evolving landscape of the nursing workforce over the next decade, especially around challenges like an aging population, workforce diversity, and educational readiness.
I'm excited to dig into this. It's a real deep dive into the issues that will shape how nurses are deployed and supported, right?
Exactly. The report makes it clear that nurses are the glue holding together the healthcare system, almost like they're the backbone that supports not just hospitals, community-based care too.
And what really struck me was how the document details the dramatic demographic shifts, both in the patient population, with more older adults and complex conditions, and among the nurses themselves.
Yeah, it's like over the last century, the nursing workforce has grown steadily, but now we're facing a double-edged sword. An influx of younger nurses replacing a retiring baby boom generation, while at the same time, the patient profile is getting more complex.
Yup, and on top of that, the disparities in racial and ethnic composition are highlighted. Even though there's progress with more RNs from minority communities, it's clear that APRNs haven't caught up quite yet with that diversity trend.
Precisely, and the report underscores the importance of cultural competence. Nurses need to be trained not just technically, but also to understand social determinants of health, like food insecurity, poverty, and say, even geographic factors.
Yep. Speaking of geography, it really hit home how rural areas are suffering due to the decline in nurses there. Fewer RNs working in rural hospitals, especially among the younger groups, could spell trouble.
That's a major concern. Rural hospitals and communities already face barriers in accessing healthcare. And if fewer nurses choose rural practice, then these communities will be even more underserved.
And then you have the issue of mental and behavioral health. The report shows that even before COVID-19, there were clear warning signs with rising cases of substance abuse and mental health crises. How do you see nursing fitting into that equation?
Well, nurses are in a prime position. They're often the first point of contact. But the report clearly points out that not enough of them are being trained specifically in mental and behavioral health care. It's a gap that's only going to widen if nothing changes.
Okay, but here's a thought. Some argue that nurse practitioners, for instance, might not have the same level of training as physicians in mental health. Do you think these restrictions on scope of practice are warranted?
That's an interesting point. The report challenges that notion, presenting data that shows restricting the scope of practice actually decreases access to care. It suggests that letting APRNs practice to the full extent of their training, especially in underserved areas, can actually improve outcomes without compromising quality.
Yeah, I see that. I understand the argument for quality control, but I wonder if there's a risk of oversimplifying the issue by solely blaming regulations. There's a balance between flexibility and ensuring that standards are met, isn't there?
Absolutely, where the nuance comes in. The report doesn't claim that all restrictions are bad. Instead, it shows that in many cases, overly restrictive policies only contribute to higher costs and reduce the agility of the workforce. It's a delicate balance.
That's a fair critique. Speaking of cost, there's some data in the report showing that despite high RN salaries, their value is often only seen as a cost rather than an investment in quality care.
Yeah, it's ironic. With average earnings rising to around $76,000 for RNs and the total nursing salaries amounting to hundreds of billions of dollars, the narrative usually focuses on expense, even though nurses contribute significantly to outcomes and cost savings in the long run.
And then there's the sustained contributions of nurse practitioners and other APRNs. Their role is expanding in primary care, physical health, and even in specialties like maternal health, which the report flags as critical given persistently high maternal mortality rates.
That's spot on. The data shows that, although we've seen some growth in MP numbers, their distribution in specialty care areas like women's health or mental health remains limited. This is a crucial point because as needs expand, especially in underserved areas, the lack of specialization in these fields is a big gap.
True. It's also interesting how the report talks about educational backgrounds. There's been a notable shift from hospital-based diploma programs to university degrees. But do you think that transition has fully prepared nurses for the challenges in community and population health?
I think it's a mixed picture. On one hand, higher education has definitely expanded nurses' skills, and led to roles that touch on research, leadership, and advanced practice.
Yes.
But on the other, many graduates still feel underprepared for the realities of community health and addressing social factors, which the report stresses as vital.
Yeah, it's like the curriculum still needs to catch up with the evolving needs of the population. And with the increasing diversity of patients, there's a demand for culturally informed care that might not be adequately covered by traditional programs.
Exactly. The report calls for a significant strengthening of education and training on social determinants of health. Without that, nurses may struggle to meet the complex needs of communities, especially those facing economic and racial disparities.
That's a key takeaway. Another challenge raised was the potential fallout from the COVID-19 pandemic. Nurses faced enormous stress and risk, and the pandemic has had huge implications for their resilience, both physically and mentally.
Absolutely. The pandemic not only increased workloads and stress, but also led to furloughs and layoffs in some settings, which ironically could accelerate nurse and prompt more premature retirements.
Yes, unfortunately. And as those experienced baby boom nurses retire, there's a potential knowledge gap that will be hard to fill. New nurses, despite being well educated on paper, might lack the institutional wisdom that comes with years of hands-on experience.
True, and that is particularly worrisome for non-acute care settings, where continuity and deep clinical judgment are essential, especially when dealing with complex, chronic conditions prevalent among older adults.
Exactly. I also noticed that the report touches on how regulatory hurdles can exacerbate these issues. If state-level restrictions on NP practices remain, then even an expanding workforce might not effectively fill the gaps. Right?
Definitely. It shows that in states with full practice authority for NPs, the access to primary care is significantly, but in states with restrictive policies, shortages remain pronounced. It's almost like the policy environment directly influences patient care availability.
Yeah, totally. So, what do you think are the key strategies to address these multifaceted challenges, especially considering the simultaneous pressures from aging populations, workforce diversity needs, and regulatory changes?
The report suggests a multi-pronged approach. First, scaling up the numbers, training more nurses, especially in critical roles like primary care, maternal health, and mental health. Second, diversifying the student body to ensure that nurses reflect the communities they serve. Reforming regulatory barriers to allow nurses to fully deploy their skills in practice.
That makes sense. And what about the economic challenges? It seems there's a paradox, where nurses are vital but also costly. How do we justify stronger investments in nursing given budget constraints?
That's where the long-term perspective comes in. Investing in nursing isn't just about paying higher salaries. It's about building a system that reduces overall costs by preventing hospitalizations, improving chronic disease management, and ultimately enhancing health equity. In fact, by removing unnecessary scope of practice barriers, there's evidence that millions more residents could gain access to primary care, which would save money in the long run.
I agree. One thing I really appreciate from the report is its emphasis on research. It calls for monitoring and evaluating how these changes in education, policy, and practice actually affect outcomes. Without data, it becomes difficult to know whether we're on the right track.
Exactly. It outlines a robust research agenda, studying everything from the impact on mental health care delivery to examining the quality of care in populations experiencing social disadvantage. This research will be critical in fine-tuning policies and practices along the way.
Yeah, that's essential. It's a comprehensive vision. But I wonder, with so many moving parts, how do we ensure that these recommendations are implemented uniformly across different states and regions?
That's the challenge, isn't it? The report makes a strong case for leveraging programmatic, policy, and funding opportunities across multiple sectors. Health systems, governments, and educators need to collaborate closely. Standardized metrics and consistent data collection across states could help synchronize efforts and ensure that improvements are evenly distributed.
Absolutely. And one of the more forward-thinking aspects of the report is its attention to social determinants of health. If nurses are to truly improve health equity, they need not only clinical skills but also training in understanding and addressing factors like poverty, housing, and education.
And that's no small task. It requires innovation in curriculum design and perhaps even rethinking what we consider nursing care today. It's about expanding the role of nurses
That expansion
to function
is
as
crucial.
advocates and community anchors.
In summary, tackling the future of nursing means addressing a mosaic of issues: educational curriculum reforms, regulatory changes, workforce redeployment, and, above all, a commitment to health equity for diverse populations.
Well said. The nursing workforce is at a pivotal juncture. It's both the backbone and the future of healthcare. The challenges are enormous, but so is the opportunity for transformation.
You're right, absolutely. Thanks for such an engaging conversation today. It's definitely given us a lot to think about, especially as these trends will impact care delivery well into the next decade.
Yep. And here's hoping that decision makers, educators, and policymakers use these insights to build a more resilient and equitable healthcare system.
No doubt about it. All right, that wraps up our conversation for today. Thanks for exploring these critical themes with me.
Thanks for tuning in. Until next time, keep pushing the envelope towards a healthier future for everyone.